Well, for the sake of time, I think we'll go ahead and get started. So I'm smiling from ear to ear, seeing all of these familiar faces. Welcome to the second annual Tideswell Emerging Leaders in Geriatric Special Interest Group meeting. My name is Megan Young. I'm one of the SIG co-chairs. I'm at Boston University, a geriatrician at Boston University School of Medicine. And I want to introduce the other SIG co-chairs. If when I say your name, if you could just say hello or wave so people can recognize you. I see everybody turning their camera on. I really love seeing people's faces, so if you're able to turn your camera on, please do. So first I'd like to introduce Tim Farrell, who's out at University of Utah. Say hi, Tim.
Everybody, good afternoon.
Maile Karris, who's at University of California, San Diego. Say hi, Maile.
Hi, everybody.
And then Liron, I'm not going to mess up her last name, so I'll just leave it out at Northwell Health System in New York. Say hi, Liron.
Hello, everybody.
So the four of us co-chairs have spent a lot of time thinking about how we wanted to spend the next hour. And I think, this SIG meeting is taking the place, replacing what would have been our in-person meeting at AGS. And our original theme for that meeting was going to be geriatric evangelism, or as I say, geriatricizing those non-geriatricians. And I think we decided in part we wanted to keep with that theme, given that the pandemic has put our patient population in the spotlight, for better or worse. And many of us have been called to step in and help our non-geriatrician colleagues take care of the patient population we care so much about. I think the other thing the four of us talked about is there has been a lot of loss over the past few months. And not just patient loss, although that has been just huge, but also the loss of weddings, graduations, birthday parties. And one of the ways, at least the four of us have coped with those losses, is staying connected to each other, but also staying connected to family and friends and colleagues. And I think there's no better theme of Tideswell than connectedness. We've also reflected a lot on what matters to us, and makes me think back to Christine's session on your own personal vision and mission statement. Although I promise we are not going to ask everybody to write their own vision and mission statement today, but simply to reflect on what matters to you. So for our agenda today, we're going to hear from some of the Tideswell faculty, some of the AGS leaders. We're going to break into small groups, and Anna says, this is the time for storytelling. And I say, I'm a geriatrician. It's always time for storytelling. But I would encourage you in those small groups to really tell your story. There's amazing work being done by people on this call that before COVID and now. And so share your story and get connected or reconnected. Before we start into the agenda, I have to acknowledge that I think the past 10 days have been almost harder or even harder than the past 2 months. And many of us in leadership positions have been reaching out to colleagues, families, patients, our own children to talk about what's been happening. And so I wanted to share an email that I wrote to the students that I mentor as one of the assistant deans, and then observe a moment of silence before we get started. Dear students, I am reaching out in these troubling times and uncertain times. In the midst of so much suffering, loss, and turmoil, I am thinking about you, each with your own story and your own hope for your future as a doctor. The world needs you more than ever, and the hard work you are doing to become a doctor is a gift to this world. The murder of George Floyd by police has put a spotlight on a tragic problem in this country. It has also highlighted the systemic racism that still undermines our ability to achieve our ideals of a more equal and just society. This comes at a time when the pandemic has laid bare the inequality in healthcare in our country and caused grief and suffering for so many. The pandemic has also made it difficult to give each other the one thing that we all need at times like this, which is the care and support of each other. But even though we cannot be physically together, as human beings, we have a powerful capacity to connect with words. And the fact that there are so many across this nation making their voices heard is a seed of hope that change may follow. Let's reach out and care for one another. Love is one of the most important parts of healing. So if we could take a moment of silence to reflect on what's been happening in the past week, and I will bring us together afterwards. Thank you. I would like to now introduce Anna, although I don't think she needs any introduction. Are you here, Anna?
Megan, I am. I just want to thank you so much for getting us started. Hello, everyone. I can't tell you how wonderful it is to see you. We're looking forward to hearing from you. Thank you for what you have undoubtedly been doing for older adults. Thank you for choosing to lead in this time. And thank you for making the time to be here today. You were all with this program in different years, and so let me introduce to you the current program leaders to you. You will remember many, if not all of them. Mindy Fain, Bill Hall, Ted Johnson are our extraordinary small group advisors. We treasure our partnership with AGS, and we welcome CEO Nancy Lunenburg and also President Annie Medina Walpole here with us today. Christine Ritchie, our founding program director, is now leading research at Mass General and remains our program co-director. Sarah Van Zanten, you have met on email, and also here is our fabulous new program manager. And we're thrilled to have Louise Walter, Chief of Geriatrics at UCSF, as one of our program co-directors. And I'm going to turn it over to Louise.
Thank you, Anna. It is my honor to be part of the ELIA program now as a co-director. And I just thought I'd say a couple quick things before introducing the video. So truly, this is a time for leadership and compassion. And I just read a Harvard Business Review about leading in times of trauma, and really focused on the importance of being a leader who enables compassion in the workplace and a place for people to heal. And I took a quote from the article that compassion heals, but it is up to you as leaders to bring it out swiftly, spread it to every corner, and manage its impact. And I think that really resonated with me is how do we enable compassion throughout our organizations. So I thought I'd share that. And now I'm delighted to introduce, we're gonna have a 5-minute video featuring ELIA alums talking about their experiences during the COVID-19 pandemic and the things that they learned during the ELIA program that have helped them during this difficult time. So I'll turn it over to Sarah in the video.
The COVID-19 pandemic has really been really life-changing for me in many ways.
So much has changed due to COVID-19, everything from my day-to-day routine, where I work, how I work.
The biggest change for me has been trying to navigate work and childcare and the additional domestic work that comes with having an entire family be in the house all the time.
You know, juggling the work, the research, the family. I think everything has sort of merged together for me, and just taking it day by day.
I've also been discouraged by recent publications highlighting the negative impact of COVID-19 on working mothers, such as the drop in article submissions from women.
I think soon after everything shut down here in Boston, I was talking to one of the medical students in the medical student residence here that we have, and decided, well, this could be a win-win, you know, and immediately got on email and got almost 100 medical student volunteers to call about 500 of our geriatric patients and just reach out and and really do a social call and a check-in. And I think, maybe it was because of the time, but the stories that the students told and the social histories that I heard from those phone calls were some of the richest social histories I've heard from any medical student that I've worked with.
I remember in the first few days just being a complete wreck because, these older people were coming in so sick and there was very little we could do for them.
I'm afraid that this pandemic will push back years of advances that have been made in gender equality.
And I had my first daughter when I was a resident. I do have to say this is the longest time in my entire life that I have spent with my children. And that's pretty special too. And I know a lot of people around the country, even though we're all tearing our hair out trying to do homeschooling, I try to see the positive and think back to, wow, this is really the most time I've ever spent with them.
After a long day, I hug my kids and I get on social media because I feel I have a responsibility to combat the misinformation that's circulating around COVID-19. Two things that I learned during ELIA that is helping me as I navigate social media are crucial conversations and telling a story. Those approaches have really assisted me in moderating respectful discussions between people with polar opinions and between people with differing opinions that I have.
Yeah, so two things that I learned from the ELIA program that are directly relevant: crafting a compelling message. I've had an opportunity to speak about the resource allocation work with some media outlets. Secondly, I remember the specific session on what to do when the sands shift underneath your feet and how to adapt.
I think we've learned different techniques that maybe not everything needs to be done in person. So I'm excited to see how things go.
The other thing that I haven't talked about yet that I took away from Tideswell were all of the people that I met in my cohort. And certainly during these times, it's been really neat to see people who I spent a long time with, in the news, on TV, on social media, in their various fields, talking about how to care for older adults and our patients who were particularly affected.
I've heard from long lost friends, including my best friend in 7th grade, who I haven't heard from probably in 30 plus years. And we've now been having regular Zoom calls. Aside from anything having to do with leadership development, I think looking for some silver linings in all of this, and also thinking about how not just reconnecting with friends will be different, but also connecting with patients and how that could be somehow improved over the way.
I think that we all enjoyed our experience with Tideswell so much that me and Maile and Megan and Tim really wanted to preserve that and be able to enjoy Tideswell for as long as we can. So I think it's important for us to have this SIG, and we hope that others will join us and participate, and then we can all stay connected as a community.
It's my pleasure to welcome Dr. Christine Ritchie to share her thoughts and experience around leading through a crisis.
Well, I just wanted to say what a pleasure and true gift for the day, for the week it is to see all of you here and to have this time for reconnection. And for all of you who are new emerging leaders and aging scholars, it's just lovely also to see you in live human form. And I'm hopeful that despite all of life's twists and turns, that this year will also be meaningful and instructive to you. In my experience, leading during a time of during COVID-19 has been an exercise in paying attention, a time for deep listening, for suspending assumptions, and for getting out of my own way. This is the only way to see reality for what it is rather than what we assume it to be or what we want it to be. And this is the only way that we can see the possibilities that this new moment brings us rather than just the sorrow of it. And though we are all mainly masked, although we aren't masked right this minute, but although we were mainly masked, COVID-19 has unmasked our country's profound inequities. Inequities about who gets COVID, those without PPE, those without the ability to socially distance, as in our nursing homes, prisons, and favelas, those who have to use public transportation, those who have multiple underlying comorbid conditions. Inequities about who gets the short end of the stick, those who are people of color, who live in fear of being stopped by the police, of deportation, of jogging, of worrying about what's going to happen to them when worshiping, those who are incarcerated, often for thin reasons, and many because they were born into families without social capital and without recourse when life did not go their way. And I don't know about you, but for me, these inequities, they can be demoralizing. And the solutions to them seem out of reach or baffling. So one can be tempted to retreat or to look away. I think our opportunities are to lean into these inequities and find solutions, large and small. It's to identify disconnects in policies and legislation and advocate for change. It's to partner with communities that have suffered the most and to come alongside them to listen, to seek to understand before speaking, and to bear witness to suffering before thinking about fixing. For me, the past 3 months have plunged me into leadership situations that we have discussed during our Emerging Leaders in Aging program, but that I don't think I personally have ever experienced with such intensity. For example, working in a brand new health system and practicing influence without authority, engaging in emotional self-regulation, holding other people's distress, and practicing generosity. This time has also helped me learn new things, or at least in new ways, which is to don't worry alone and to focus on service rather than recognition. I think COVID-19 is bringing about a great reckoning to our whole world, and this reckoning will give us a chance. It will probably force us to rethink everything about the way we care for each other, about the way we care for our older adults and others who are vulnerable. It can polarize us further, or it can give us an opportunity to come together in our strength and in our vulnerability. Seeing each of you here brings me great encouragement. It brings me great optimism, because each of you are building blocks to putting together a new way of thinking, and doing that better will have the potential of addressing some of these inequities. Each of you are committed to contributing to a better world and to a better society, that the way it is now does not need to be the way it is in the future. So I am very grateful that you are in the world working on these inequities, and I'm grateful that you have chosen to become an emerging leader in aging. And I hope that we can support you, continue to support you, and that we will all support each other as we go forward in our work together. Thank you.
Thank you, Christine, for your poignant thoughts. It really gives us a lot to think about as we continue the conversation amongst our scholars in our breakout groups. Before we start, I'd like to introduce Meredith Green. Meredith, if you can wave, I see you drinking coffee. So we originally had invited Meredith to be one of our speakers when we were planning our live SIG. And because the response to this virtual SIG meeting was so robust, we realized that we were going to need another moderator. And Meredith is also an alum in the clinical group, and we asked her if she'd be willing to lend her time and her voice and her expertise in helping us to moderate the clinical group. So she will be also participating. A couple of other things to really respect our scholars and our individualized experiences. I want you all to know we're not going to be recording the small groups, so feel free, please, to speak freely. I also would like to encourage the scholars to use the hand raise reactions as well as the chat options to make sure that we can speak coordinated and not all speak at the same time. We also would like one scholar from each group to volunteer to briefly report out to the bigger group about what they're hearing in our general discussion. Okay, is everybody ready? Let's go.
Okay, so I want to thank everybody for sharing. I know we had really, really enlightening conversations in our group, and everybody really told their stories, which really was very, very nice. So we're going to go around to each small group, and I know everybody has a representative who was sharing. So how about we start with my group? Brian, you can go first. Really, and we can spend, a minute or so just each group.
Sure, I'll try to condense into 1 minute. So we had a great conversation. I think almost everyone identified both challenges and opportunities. Our group was specifically focused on researchers. A lot of work-life balance issues came up, both from a sense of time for work-life balance, but also for this risk of work-life balance, like in terms of risks to ourselves and our families from going back to work. Other challenges were this difficulty maintaining focus and presence across a variety of roles as we've changed, both because of this time of crisis and because of the distancing, and difficulty continuing individual research programs in the face of the barriers to research from COVID. But that also brings up some of these opportunities, where some of the challenges is trying to decide which of these opportunities for doing research due to these changes that are happening we could take and make our research program stronger, and which of these opportunities are just distractions. And also the opportunity to put into practice some of the leadership skills that we've learned here in this time of turmoil. There's need for leadership across many of our institutions and health, and several people hit on features of that. And then just these general opportunities of having new research opportunities and making new colleagues, new collaboration.
Great, thank you, Brian. Can we have the representative for Maile's group?
I think it was Nick, right? You volunteered, right?
Oh, sorry, I was on. Yeah, so we were I guess technically we're in the research group, but it sounds like there was some overlap. I think we had a very similar kind of discussion, walking through just some of the unique challenges we're each facing and juggling work-life balance. I think there was some identification of some of the ways that the situation with COVID is allowing the leveraging of certain types of technologies that could be helpful. But in many respects, I think we spent a lot of time at the end talking about some of the tensions that we all feel around whether or not to push hard into shifting or reorienting aspects of our research to focus on COVID, and some of I think we were all enjoying, voicing the fact that there's certainly pressure that we all feel with that, but also recognizing kind of, we need to think carefully about whether it makes the most sense to just jump on to that. And there was a diversity, of options, right? Just adding supplements or trying to really reposition a line of research. But it was, I'll just speak for myself. It was great to just have, to hear other voices just share some of their own experiences juggling all and know that you're not alone in some of the thoughts that you're having as a clinician and a researcher.
Thank you, Nick, and your group. Can we have Megan's group present?
Kevin is going to report out.
Yep. Okay, I just unmuted. Thanks. We had a very robust discussion, largely focused on education, some clinical. And I was able to identify 4 different themes that came up from our conversation. Much of it was medical school focused. One of the first themes was at this time when we are still trying to protect ourselves and bring our students back to direct learning, how do we rationalize their position as being essential, but at the same time having a mentorship role where we need to protect them, making them feel like they're included and not necessarily marginalized because they're medical students, and to redevelop that apprentice-teacher relationship, which can be challenged in these particular times, and also how to be more close when we need to socially distance. I think one of the things that I enjoy as a teacher is having that close relationship, which is not necessarily one that involves touch, but it's close proximity, and now we have to be distant. And how do we look at all of those challenges and make learning robust and successful as it was before? The second theme that emerged was some of the disciplines that are represented in Tideswell are ones that rely very much on hands-on training, and the virtual environment makes that quite challenging. And it can also impact clinical care as well. Very unique perspective that I had not thought about before. The third theme was how to overcome inertia because of the gap that has occurred in training and learning. Many of the students are coming back and are not following the same trajectory that they were on before, especially sub-interns that really need to turn it on. And at the time that the COVID epidemic hit, that was a point in their training when they really needed to be on top of their game. So that in and of itself is a challenge. We can't turn back the clock. We just have to keep moving forward. Find ways to overcome that inertia. The next point was inpatient teaching. We heard from somebody who is in the middle of the hot zone in New York City and grappling with the difficulties in teaching and being a very effective teacher, but at the same time prioritizing patient care, which must come first. And then the continuous flexing that has to occur as a result of clinical care paradigm changes and also policy changes. And then finally, we received a pearl of wisdom from Bill Hall, which I know I always appreciate. And he made me think about something now that I've been thinking about for a while, and that's, what is leadership in these unprecedented times? And he suggested that many of those to learn our leadership skills is to concentrate on our strengths. But he brought up a very important point that now I might not think we understand our vulnerabilities and those of others, and in that way that might make us more effective leaders as we move forward.
Thank you very much. So we're a little short on time, so the last two groups, Tim, do you want to have your group present?
Yes, Leah, do you want to briefly summarize our group discussion?
Sure. Our group was also focused on education, and we talked about how the adrenaline of the first few weeks and months are starting to wear off. So we're pivoting to what life looks like in our new reality. And there was a main theme of innovation. So one of the best sort of analogies about the evolution of technology that I heard in our group was that when newspapers initially went online, they were just putting up a PDF of the paper, and now they're innovating, and like New York Times is creating amazing content. So that's probably analogous to how our teaching will innovate. We'll initially just put up our PDF syllabuses, but we're going to try to make things much more innovative as time goes on. And there's some positives to our new reality and benefits to telework and education. It's in some ways easier to get people together. And one of our group members, Ryan, talked about creating new curriculum for fellows during the pandemic, and that innovation can be really fun. And we learn how to teach physical exam skills via Zoom and things like that. And then on a personal note, we reflected on some feelings of responsibility to keep it together and put on a brave face for our learners, which can be tough on us. And a lot of people reflected about the overwhelming personal toll of what's been happening and how important it was, even in spite of having feels like less time to take care of ourselves, but it's so important, and recognizing how precious life is, and that we have to take care of ourselves in order to take care of others.
Yes, thank you. That's great. Okay, and the last group, Meredith?
Sure, I volunteered myself to report out. So in the clinical group, I think there were actually a lot of commonalities, which I think is really important to hear right now. I mean, from all over the country, including very hard hit areas like New York City, but also people working in really hard hit settings like the emergency room and skilled nursing facilities. There were several challenges that came up, including like isolation and mental health issues related to that people are seeing in their patients. Challenges addressing the digital divide and switching everything to telehealth. I think a really common concern that came up is around budgetary issues because of how health systems have been hit, and now whether programs are going to continue. And another theme though that I heard was people have really had to shift tasks and shift focus. And despite that, I really heard from this group how resilient they are in being able to shift to all these new things while managing personal challenges as well with childcare. That also came up frequently. And I think the last thing I would say was also hearing from the group around how roles of geriatrics and palliative care have risen in some settings, including like an emphasis on advanced care planning and things that many of us value, and that there's now able to have some voices. And I think there's a lot of work for advocacy in the future.
Thank you. Tim, I believe you're taking over.
Yes, so I know we're coming to the top of the hour. Actually, I'm going to invert the order a bit and just say, I want to maybe have Dr. Medina Walpole and Nancy bring us home, but just to say, you will all be receiving a survey that will ask you about this session, whether you'd like to continue this type of virtual engagement going forward with Tideswell in this fashion, as well as some of your preferences about how we communicate with you as our SIG. And as you can tell, Tideswell and our SIG really collaborate pretty closely together. And we want to make sure we give the opportunity to hear your voice about what worked, what didn't, what you'd like to see going forward. With that, I'm going to ask Dr. Annie Medina Walpole, Chief of Geriatrics at University of Rochester and President of the AGS, and Nancy Lundenberg, CEO of the AGS, to bring us home with a minute or so for each on your reflections about what we've heard today. I'd also want to thank you both for participating. I know how much you have on your respective plates, and a warm thank you to everybody for participating. But take it away if you would, Dr. Medina Walpole, and then Nancy.
Okay, well, good afternoon. So I'm just delighted to be part of this SIG meeting. So what a wonderful hour it's been. It's actually been the highlight of my week. And, going to the annual meeting is energizing, I think, for all of us. Seeing my colleagues, I'm seeing my best friend, Ted Johnson, on the phone. I'm seeing Bill Hall, who I don't see all the time now. And so it's really energizing. So thank you. It's fulfilled a need that I've had for this entire period of time. So first I want to say congratulations, and I want to thank each of you. You really are the leadership legacy in academic geriatrics, and I'm so excited that you are our current, certainly, and our future leaders. So from my experience with our own Rochester faculty, we've had many that have participated in this amazing program, and I think that Tideswell gives you tools. It gives you the tools that you need, and now it's really up to you. So again, we've seen a very challenging time, but I love hearing about opportunities. And so I'm challenging you to take this expertise, take this new skill set, make a difference in the lives of our colleagues, of our patients, their families, our communities, our academic communities, and our home community. So sort of go forward. My advice is embrace everything you've learned every minute with these colleagues, and what a rich peer mentorship group you have. From what I just experienced in the 15 minutes with the clinical group is I'm sure anyone in that group would be happy to reach out and support a colleague. So take your time to phone this amazing group of friends and colleagues that you have. And then finally, I think the SIG is a wonderful idea, and it's just one of many ways you can be involved with AGS. So my involvement with the AGS is really amongst the most rewarding things I've done professionally. And so I encourage all of you to get involved and let me know. If you need advice and if you need help, just phone a friend. I'm close by in Rochester to all of you. So thank you again for this opportunity to participate and really share this special hour with you.
Thanks so much, Dr. Medina Walpole. And
okay, so first of all, just call me Annie, Tim.
Yeah,
really.
Annie, sure. And Nancy, would you bring us home?
I'm glad that I didn't become Ms. Lundeberg in that in that introduction, Tim. I would have been very, very upset. Hi, I'm Nancy Lundeberg, CEO of AGS, and I am seriously hoping that the current crop of Tideswell scholars does get to meet in December in San Francisco. I will, Annie and I have been sort of mourning, to pick up on her theme, the opportunities to get together that have slipped away this year for all of us to get together and sort of drink from the well of being with like-minded people. And so actually I've been on a number of these Zoom calls over the past several weeks, and as Annie has noted, they really are a highlight of my week, and it's wonderful to sort of close out Friday and see all of you folks. So I do want to pick up on something that Christine said, which was around resilience. Just I happened to be sort of, once the fabulous Sarah sort of figured out how to connect me and my iPhone into the research, one of the research groups, I dropped into that and heard what I thought I would hear, which is that folks are struggling with work-life balance, with making decisions. And I certainly am not a clinical person, so I don't have some of the same worries and concerns that you do. But do want to say that you should make decisions that are consistent with sort of what your North Star is, and make decisions around both what your need is within your personal life and then within your work life, and definitely talk to colleagues at work. And as Annie noted and others have noted, reach out to the peers on this call. You are all a tremendous resource to each other. And in terms of really taking care of yourselves, I think just taking that time to remember not to take on too much, which is certainly something that I suffer from, is, okay, we can do that. And then the AGS staff will look at me and say, and who is the we that you're talking about, Nancy, at this point in time? Because they're sort of fully stretched out. So I want you all to hear that you, in both the pandemic and the events that have rocked our world since the the several deaths in the past couple of months, that we really have a responsibility. If we're going to be the leaders that we want to be, we have a responsibility to take care of ourselves as well, because we can't be that kind of leader if we're not taking the time for self-care, for mindfulness practice, to reset ourselves, to re-engage. And I will close on that, Tim. So you can actually take it home, I think.
Okay, that's wonderful, Nancy. Thanks, everyone. We're a little bit over time. Did Anna, Liron, Megan, I know Maile had to go see a patient. Does anybody have anything else they wanted to add that we may have overlooked? Okay, with that, I'll bid everybody a good afternoon. Thanks so much for joining us. And please do fill out the survey so we can know how best to replicate or evolve or morph this session into something that will be of direct benefit to all of you. And keep doing all your good work, and have a good afternoon and a wonderful weekend. Thank you.
Thank you.
Thank you.
Thank you.
Bye.